Doctor, you mentioned patches of brown or yellowish pigmentation on a skin otherwise normal. Yes, it is cicatrixes of the skin. And this cicatrization was what? It was the healing by scar formation. Doctor, the excretory duct of skin was plugged by discolored sebum? That is correct. And what is confluent, doctor? It is the lesions joined or run together. And depigmentation? Depigmentation is the partial or complete loss of pigment. It occurs in albinism, atrophic skin, and scars. Doctor, what is dermographia? That is skin writing. Urticarial wheals appear where the skin was marked by pencil or blunt instrument. And what is discoid? Discoid is shaped like a disc. And discrete? Discrete is lesions which are disconnected and separate from one another. Doctor, what is ecchymosis? It is a purple spot or bruise due to seepage of blood into the skin. And eczema? Eczematoid or eczematous is an eczema-like inflammatory lesion which tends to thicken to become scaly, vesicular, crusty, or weeping. And an eruption is what? An eruption is a rash or skin lesion. And erythema? Erythema is a diffuse redness of the skin. Doctor, you mentioned in your hospital record excoriation. Yes, excoriation is a linear break of skin or scratch mark due to surface trauma. And granulation? Granulation is a method of repair or healing following loss of tissue or pyogenic infection. What is guttate? Guttate means drop-like. And kerototic? Kerototic is pertaining to a horny thickening. Doctor, you mentioned in your hospital record the hyperpigmentation of the patient. Yes, the presence of an abnormal amount of pigment in the skin seen in a considerable number of systemic diseases such as adrenal insufficiency, acromegaly, and others. And in the familial progressive type, what happens? Well, in the familial progressive type, as you put it, it is a hyperpigmentation of patches of excessive pigmentation which enlarge in size with increasing age. Doctor, what is intertriginous? Intertriginous is between two folds of skin. And the macule? The macule is a discolored patch or spot on the skin. What are milia? Milia are tiny white nodules appearing on the skin, frequently below the eyes. And moniliform is one-headed. And multiform, several forms of the skin lesions. Doctor, what is a papule? A papule is a pimple. And petechi are pin-sized hemorrhagic spots in the skin. What is proliferation? Proliferation is a process of rapid reproduction of the similar cells. And seborrheic, which pertains to seborrhea, an oversecretion of sebaceous glands. Doctor, is that similar to vesication? Well, vesiculation is a formation of blisters, yes. And areolar tissue? Areolar tissue is an area of pigmented skin surrounding the nipple. It becomes dark during pregnancy and remains so thereafter. Doctor, what are abscesses of the mammary? It is a localized collection of pus of mammary tissue. And athelia? Athelia is the absence of a breast nipple. Doctor, what is breast cancer? It is a malignant mammary tumor, a painless or painful mass which may be associated with skin and muscle attachment, discharge, crusting and retraction of the nipple, changes in contour of the affected breast and metastases to regional lymph nodes. And what is carcinoma? It is a malignant tumor. Of what? Well, in this case, a sarcoma of the breast, rare, non-epithelial, malignant mammary tumor, for example, cystosarcoma and fibrosarcoma. And a cystic disease of the breast is what? It is the most common breast lesion composed of gross cysts that may be accompanied by microscopic cysts. Hagerson distinguishes four types: galactoseals, which are cysts containing inspissated milk, cysts formed in duct ectasia or dilated duct, cysts due to fat necrosis caused by trauma, and cysts related to intraductal papilloma. What are cysts related to intraductal papilloma? Those are the fissure of the nipple, a deep furrow in the nipple, and hyperplasia of the breast, that is hypermastia, or abnormally large, usually pendulous and sagging breasts. What is hypoplasia of the breast? It is an abnormally small breast. Doctor, unilateral hypomastia, that is one breast underdeveloped, the other normal or overdeveloped. This results in mammary asymmetry and disfigurement. What is bilateral hypomastia? Both breasts are abnormally small. Occlusion of lactiferous ducts. Blockage of lumen of milk-conveying ducts. Paget's disease or cancer directly beneath, seen in elderly women. The areola and surrounding skin may be weeping and eczematoid. Doctor, what is thelitis? Thelitis is an inflammation.
There were a lot of things in there. Just going.
Yeah, it's tough to. So are there any words you didn't know?
There were a lot of. It was, when you were saying
just do-
weeping,
Huh?
you were saying
Weeping, yeah.
Thelitis?
What?
Thelitis?
Yeah, Thelitis. What I like is intertriginous,
yeah, okay.
between two folds of skin.
Wait, let me go back.
Let's take a break.
Athelia.
Thelia.
It's not athelia, it's thelia.
This is Thelia.
Thelia. Thelia. Athenia.
What's papilloma?
Yeah, papilloma. P-A-P-I. Let me look it up. Papilla, no, P-A, from papilla. So it's P-A-P-I-L-O-M-A.
2 L's.
It might be two L's, let me see. Yeah, P-A-P-I-L-L-O-M-A. I haven't been hearing from, what's her name? Admiral.
Mm.
So I did one.
As a wood due to overgrowth of epithelial tissue on papillae.
On what?
P-A-P-I-L-L-A-E. Papillae of vascular connective tissue.
Yeah, that would be from papilla, that would be the plural, A-E.
Ah, okay. Oh, it's a wart.
Ready? Ready for the next take?
I guess so.